Good afternoon, everyone. Welcome to Patient and Physician Referral Management in 15 minutes. Before we begin, I'd like to cover a few housekeeping items. All attendees will be muted during the webinar, but we do welcome your questions. If you have any questions, the questions box is located in the upper right-hand corner of your screen. And if you're having any problems with the webinar, like you can't hear or anything else like that, feel free to press the raise hand button or submit a question. Without further ado, I'd like to introduce our presenter for today, Director of Solutions Architects here at Infinity Infosystems, Mike Hammonds.
Thank you, Matt. Appreciate it. And thank you all for joining today in our 15-minute webinar series. So today we're going to talk a little bit about the healthcare environment and what we like to call our intelligent platform for healthcare and life sciences. We know that there's a lot of pressure today. Health organizations like yours really have some pretty heavy strategic objectives. Top of mind is improving patient care experience. And that includes, for example, quality care, responsiveness and satisfaction, reducing costs. Those are things that are not only that we kind of have top of mind, but are now directly even being mandated with ACA and additional pressures with payers, right, like Medicare, Medicaid, and the insurance companies. So that all then relates to, ultimately, as healthcare givers, we're concerned about improving the health of our populations and the people in our community. And while doing that, while improving the care, we're also having to see what we can do to at least mitigate the costs of the healthcare that we do provide. So let's talk just briefly about what we're going to cover today. And our healthcare scenarios are centered around outreach management, case coordination, and referral management, and then patient relationship management. So we wrap all these up into what we call our PRM solution, patient and physician relationship management. We're going to meet a couple of players today in our demonstration scenario. First one of those is Janet, who's going to play our patient. And a couple things that she's looking for is affordable health care, right? We all need to be able to afford the care that we need. But ultimately, she really wants to engage with knowledgeable physicians and caring staff. And that's going to really improve the overall situation. So when she needs care, she wants it to be quick, she wants it efficient, she wants to get to the right hospital or the right healthcare facility, and she ultimately wants the right care for the right issue, right? No more, no less. Let's meet Dr. Smith, who is Janet's physician. And Janet's physician has a few things top of mind as well, such as providing excellent care for her patients, and she too has the pressure of improving outcomes. To do this, she really needs help around getting patients where they need to go for treatment, and she ultimately wants to feel confident that they're going to have great follow-up care, even when she may not be the one that's doing that care directly. So really, it comes down to quality interactions with all the healthcare coordinators and providers, and when she gets that, she knows that she's going to be happy, her patient's going to be happy, and ultimately, it's going to improve the care that she gives to her patients. And then finally, let's meet just various members of the team, right? There's a tremendous amount of people that are involved in the healthcare continuum, from the physician to the coordinators to nurses to specialists. You know, everybody plays their part, and they're all very important. And they all interact with the patient. You know, there's a big trend today in what they call customer engagement, and it used to be that you know, patients were just treated as patients. You know, you get them in, you treat them, you get them out. But now it's more and more about the experience. And if you think about it, it's that experience, whether I'm going to the hospital or going just to my physician office, or whether I'm going to a local store. You know, if I get that good, high quality care and my services are met the way that I expect, I'm going to be a happy camper, right? And I'm going to continue to do business, right? So with that, ultimately, the other people are also interested in providing excellent long-term care, and they too need to be able to do it quickly and efficiently and help the patient as effectively as they can. So with that, let's jump into our demonstration. So here we're starting at our agent dashboard, and what's nice about this is this kind of keeps me on top of everything that I need to do from, in this case, an inbound patient referral. So Dr. Smith is transferring Janet into our facility. And I'm one of those care coordinators that takes those initial calls from either the physician or his office or someone in his office, sometimes even directly from the patient. But what I like about the dashboard is I can immediately see at any time what's going on. So I can kind of scroll down and I see we've got some cases by referring institution or people, cases by user, today's cases. What's nice is I can immediately drill down into any one of these and just very quickly navigate to, for example, I need to see how many beds we have available for this inbound referral that we have. So I see that we've got a couple in ICU and one in step down. That's great. Now I know that one of the physicians are Dr. Smith, so I'm going to do a quick drill down into the patients, and I see right there, are the physicians, and I see right there is Dr. Smith. Okay. So now I'm going to jump over to the patient screen, and this is where all of my cases that I'm dealing with, all the inbound and outbound cases that I have. Okay. So I'm just going to do a quick little search for Dr. Smith, because she's transferring Janet in, and I see there is the information here, so I can simply drill down into those details. And now I see at a glance everything that's important for transferring this patient into the right location and tracking who's doing the transferring. Is it an inbound? Is it an outbound? What department are they going to? What's potentially some of the follow-up information? And I even see some detailed notes over here, and I see exactly when she's coming in, and we'll be ready for that referral when she hits our doorstep. If we scroll down a little bit more, we can see that what's also nice is we built in some capabilities just with a single click page the physician. So as soon as Janet gets here, we want to page the physician, let them know that, that she's here and that we've got it and we're taking care of her and getting her into the right location. So we can do those types of things, just making it very simple to communicate and coordinate with the other healthcare professionals in our organization. Now, let's take a look at, for example, the reverse scenario. Okay, so we've got Janet in. She's maybe had a couple of tests done, and she's had a little bit of treatment, and now we want to transfer her out. Okay? So a big trend today and a big need today is really around making sure that we're able to transition the patient out correctly, do the steps that we need to do that in the most efficient way and make sure nothing falls through the cracks, that either paperwork's not being missed or other things along those lines are all being done. And so that's what we're using our outbound for. So in this case, we're going to do the same thing. We can drill into our different dashboards. We can see the details. So I'm going to look at my customer dashboard. And now I'm just going to go in and take a look at, for example, all of my cases. So we go into my service area. And actually, while I'm here, let me go back there. What's also wonderful about the system is we can now do a lot more of that person-to-person communication, even if they're in remote locations. So our larger hospital systems, we have different departments, and we're spread out in many different locations, different buildings. Some of us might be on the north side, others on the south side. So being able to coordinate whether we're either in the same room or in different facilities really improves our ability to coordinate with our healthcare providers and our patients. So this is just information that we're able to communicate directly right within the application. So within our patient relationship management system, we have this ability to use instant messaging to help each other out when we need to. So if a case volume started getting high, you can put in a quick call for help that you need somebody to help manage the queue. Right? So let's go take a look at that queue. And so now I'm looking at my inbound queue. And I know that for Dr. Smith and Janet, we're going to do an outbound case. So let's go in and look at our new case. And I'm just going to do this a quick little entry here. So for example, while Janet was in, we found that she had some potential for diabetes. She's right on the edge based upon her diagnostics and her blood work that she's potentially diabetic. So on her outbound case, we're going to do some follow-up activities. Okay? So in this case, there's Janet, and we pull in her information. And we continue to fill in some of the details here. This is a post-admission. And now, here's what's wonderful about the PRM system is based upon your own facility's workflow, we can use the automation capabilities within the application to automatically schedule a set of tasks. Okay, so whenever we do a diabetes screening, there are certain things that we want to happen. and we want to make sure that we schedule a 6-month follow-up. So boom, that's already there and on the calendar. We want to provide the patient with some details and information, some collateral, so she can learn more about potentially managing this disease or what could be in store for her. Schedule follow-up with a dietitian, schedule follow-up with a clinician, and then ultimately contact them and make sure that that patient has all of those details. Okay. So let's go in. I'm going to fill in another thing, and in this case, this is we're going to do a screening follow-up. And before that, we're going to just quickly fill out a form. So we can do a lot of forms-based management. You know, many healthcare facilities today still do things, they'll first start on the paper form, and then they take that paper form and they put it into like our medical systems like an Epic or a Meditech or a Cerner. And the challenge with those systems is while they're good at kind of keeping track of those details, they are, let's just say, maybe a little bit challenged or lacking in really the interaction and the engagement capabilities. So as you can see here, you know, it's just very simple to make a few selections and have the system drive those activities. Or in this case, we're going to go in and fill out a screening form. And these forms can be anything. It could be diabetes form. It could be maybe I've got onset of you know, maybe early stage cancer, or maybe I've got you know, more unique disease like Fabry or Gaucher or something along those lines. But the idea here is that we can take those paper forms, put them in an electronic format, and now we only have to enter that data in once, less likelihood to type in incorrect information. But we can also tie into those medical information systems. So our hospital information systems, our laboratory information systems, by simply typing in her medical record number, we can pull in the last results and have that information available to us very quickly and immediately. Or maybe we don't have that initial integration, we can just go in and fill in that information manually. Okay? So let's go ahead and we're going to complete that form, and now notice that now that form is available here. So all of the interactions that we have, all the follow-up and tasks are all related to this particular post-admission case, which are all related to Janet. So in this case, what I also like, and we'll point out here about the application, is you know, we have this what we call our process flow. So as part of our outbound process and our post-admission process, there's a number of things that we want to do. And this is what we call the business process flow or the patient process flow. And so it's just a number of things to do. So these are activities, actions. These are calendar items, and these are just reminders of the steps that are required to go through this process. So we do grab some demographic information, then we might do an initial health assessment, and then we might do a secondary health assessment. All of this is going to be related specifically to how your organization likes to do that. And as Infinity, we help with some of the best practices that we've developed in working with other healthcare organizations. And finally, we might do some follow-up, and then we'll resolve and close out that call. But now, before we finish the post-admission, I'm going to go in and take a look at Janet's contact information. Okay, so we drill into her contact details, and now look what we've got here. So based upon her past case information, it's following her, right? So I don't have to be in one place to see all those details, which is one of the challenges with some of the other systems, the EMR systems like the Epics and all. You have to flip through a bunch of different screens to really get to all the details. Well, here, all of those things that we did at the case level followed her to the detail level. So I can see all that information here, but what I'm going to do before we finish out her post is we're going to add her to an outreach program. Okay, since she's now potentially diabetic, we're going to add her to our diabetes screening outreach program. So she's going to get a number of communications from the hospital, from just that care coordination, how do you deal with the disease, what should you do from an exercise perspective, from a diet perspective, all those types of things. And so now, just by simply 2-3 clicks, I see that she's now on that outreach list, and now our outbound team and our outreach programs and our marketing teams can now make sure that she's getting that information correctly, and I'll see when any of those outbound interactions happen in here as well. So that's really the extent of the 15-minute demo. We're going to go back and just finish out with a few slides here. And so with that, you know, what's ultimately the results of a patient relationship management system? And from Janet's perspective, she does feel that she's getting an improved quality of care, and it is affordable because she's getting in and out quickly at efficiency, and the interactions that she's having with are very positive. From a physician perspective, she is feeling like She's getting quick and efficient referrals. She's getting details on those interactions, like that page when when the patient reached the doorstep. And she's also informed of the other coordinated care activity, like the outbound capabilities and the outreach programs. And then that leads to the rest of the team, where they too are able to do those assessments very quickly and very easily. They onboard or outboard the patient into the right facilities with the right follow-up care, and they can also effectively do ongoing communication both internally and externally. So with that, for joining our sessions today, we are offering to anyone who's joined the free Infinity Services Pack. So that is a day of services that you can apply to anything that we do. So that means if you're considering a new patient or physician referral management system, we'll come in and do a one-day assessment with you. We also do some work around chronic disease management using the same platform. If you're potentially considering more of the standard productivity play around Office 365 and you need improved document management using applications like Word and Excel and PowerPoint, a lot of those productivity applications that we use just day to day, you can use it towards that. Or if you've already got a system and you'd like a health check, maybe you want to see how it's designed. Is it designed correctly? Are there some areas that you can improve upon it? What could you do from a next phase or a next step? Any of those services you can use with this services pack. So all your attendees will get a follow-up email with more details on that. And so with that, we'll close out the session for today. And again, I appreciate you all joining us today.